biological dentist, but I'm a holistic doctor, and I've worked with biological dentists for 30 plus years. So I love this group, and I love coming, and I love learning more, and I love the synergy between the body and the teeth. And that's my subject today, is it dental or systemic? We need to figure out whether it's the teeth causing the problems or the body causing the problems. Very important differential diagnosis. So the root cause of disease is, the question is, for my particular symptoms, whatever symptoms you do have, are the teeth inflaming the organs, or is it the organs inflaming the teeth? And it's very important to know this for your time, for your money, and especially for your health. And this is kind of what I specialize in, that interface between the teeth and the body. So even holistic dentists, even biological dentists and hygienists are mainly trained in school to diagnose and treat the teeth. Of course, anatomy, physiology, neurology of the head and neck would be expected, but very little, even from holistic dentists, learn about the relationship between the teeth and the body. And same thing for holistic physicians and practitioners in conventional medical school, even in naturopathic medical school. We didn't have much about the teeth. 32, we didn't learn much about it. It's ridiculous. So thank God for our continuing education, right? Because this is where we learn the basics in school, and this is then the continuing ed. We really learn what the heck's going on, how to diagnose, how to really treat. So our IABDM was founded in 1985, the most holistic dental association in the country. And we understand, for example, that shoulder pain is not always simply shoulder pain. Right shoulder pain like this could be due to the liver, but it also could be due to a tooth. So we keep the body and the teeth and the mind in for a complete diagnosis. Now, all holistic dentists have this dental relationship chart in their office. All holistic doctors and practitioners worth their salt should also have this in their office, because it helps tell us the more specific relationships between certain teeth and certain organs and tissues in the body. So, for example, Chris Hustler, an old friend of many of ours, an osteopath and a dentist, made this bold statement: wisdom teeth are the #1 cause of heart attacks. And he did that because, again, if you notice here, the wisdom teeth relate to the heart. I'm sorry, that's so tiny to see, but they do. They relate to the heart, and wisdom teeth are a real problem because of the degeneration of our species, sadly. We're not the stuff of our parents or grandparents or great-grandparents, right? We don't have that broad jaw and maxillofacial development so that we have room for all 32 teeth. How many people have their wisdom teeth? Okay, so quite a few, which makes me nervous. Normally I would say that's good, but I would like to check you guys out to make sure there's absolute room in your mouth for those wisdom teeth.
You're going to tell me no.
Yeah, because those can be a silent problem, and as Chris says, a cause of heart attacks. How many cardiologists would tell you this, though? Zero. They're too busy prescribing statin drugs, aren't they? So today, we're going to talk about two terms, dominant foci and disturbed fields. So in Europe, a dominant focus is by definition an area of chronic inflammation in the body, and the tricky thing about it is that it's often silent. It's often silent. So you can have a wisdom tooth back there that feels okay, rarely bothers you, if at all, but it can be generating bacteria 24/7 that's metastasizing to the heart and the rest of the body. And that's what's called a dominant focus, frequently going undiagnosed, because who would, the pain's not here, the pain's in my shoulder, the pain's in my hip or in my gut, whatever. And the area that it causes pain and dysfunction in is called a disturbed field. So it's the focus and the disturbed field. And it can be quite distal, the disturbed field. You can have a left right tooth on the left, and you can have a left foot problem. And who would ever put those two together? Hardly ever. But that's what biological dentists and holistic doctors train and come to these seminars specialize in. Now, referred thing is taught in medical school and holistic medical school. For example, if you're a dentist or someone that leans over all the time, chronic upper thoracic spinal subluxations, misalignments can cause heart disease. I think dentists have the number 1 or number 2 most frequent cause of most frequency in having heart attacks. But also vice versa. All our gut problems from children and with sugar and antibiotics and all the junk that we ate and all the vaccines we were subjected to, etc. You know, we can have this chronic low back pain, but what's the cause? The cause can be the gut. And you can see all the chiropractors and osteopaths, etc. in the world, and until you run into a holistic, truly knowledgeable chiropractor or osteopath, you won't get that diagnosis of it's your gut, it's sugar, it's a food allergy, it's something like that. So this is well known, referred pain, but this not so much. The teeth referring pain, the teeth causing problems. So bacteria metastasize, migrate from the teeth to the body. This is well known in the Merck manual. If you find a 1935 or 1800s Merck manual, they knew all about streptococcal bacteria. You know, when you're doing dental work or you have a sore throat, they knew the bacteria goes to the heart valves. What's that called? Rheumatoid fever, right? You always heard that. Rheumatoid fever, rheumatic fever. People were scared to death of that because the bacteria is going to the valves and causing endocarditis, which can be a serious heart problem. But what happened in the mid-1950s that changed that? You don't get that rheumatoid fever diagnosis much anymore. Why? Because the pediatricians and the allopaths are quick to diagnose antibiotics, which does make a change and can sometimes be life-saving, but also cause all kinds of other problems. So I'd just like to do this brief dog leg here into this subject, speaking of bacteria and antibiotics. So 2007, seems like it was just yesterday, but it was a long time ago, I guess now. But anyway, recently in 2007, what 50-plus-year-old policy was discarded? Antibiotic prophylaxis. So back in the old days, many of us remember if you checked on that form, any form of heart disease, palpitations, angina, pain, past history of any kind of heart issues, the dentist would give you antibiotics. With every cleaning, with every filling, you would get antibiotics. However, that changed in 2007. It's no longer advised for mitral valve prolapse, rheumatic heart disease, bicuspid valve disease, congenital heart conditions. It's still advised for some high-risk patients. And the American Heart Association, AHA, and the American Dental Association, the conservative dental group, found out, and from 1950 to 2006, that there were no studies to indicate the need for antibiotics. There were no randomized scientific studies that proved that giving antibiotics before you get a cleaning would prevent infective endocarditis, rheumatic fever. And then Walter Wilson here, the doctor with the American Heart Association, said, there's no evidence that it even works. I'm just laughing because I want to cry, right? 56 years. What if they found out that golden seal was actually toxic? What would they do to naturopaths and herbalists? They'd crucify them. So no apology here. Now what are the side effects of antibiotics? They could fill up this room. The research studies are numerous. Women who have taken more antibiotics have double the chances of getting breast cancer. Childhood antibiotic use, how many had antibiotics as children? They just, how many had tons of antibiotics? I did. Childhood antibiotic use can lead to autoimmune disease, decades later. So we're still dealing with dysbiosis, so many of us, no matter how well we eat now. It's so difficult. So this is a problem, and of course it's not a side effect, it's a whole effect. So a little bit more about antibiotics. Hal Huggins, who's heard of Hal Huggins? The late, great holistic dentist in America, just died a couple of years ago. So Hal Huggins got his dental degree, and also then went back and got his master's degree in microbiology. He was so fascinated with these bacteria and other microbes. So he said that taking antibiotics is not like John Wayne. You know, you're here, oh, take that round of antibiotics. Also, remember, every time you get a surgery of any kind, no matter how clean and sterile in American surgical rooms, you get antibiotics. I mean, they just, anytime you do any kind of procedure, you're going to get antibiotics. But Hal Huggins says it's not like John Wayne. It's, in actuality, a bacteria explodes when an antibiotic goes through, breaks the bacterial cell wall, and starts killing the bacteria into hundreds of bacterial endotoxins that the body must then try and eliminate for years and years and years and decades. So it stays in the tissue, just like aluminum adjuvants stay in the tissue after we're injected with vaccines for decades. So everybody knows about antibiotic resistance. Even the conventional doctors are talking about it now. You know, MRSA, VRSA, etc. It's very dangerous to go to the hospital, right? Because if you get a severe infection in the hospital, your odds are very scary on getting out of there many times. So, is bacteremia a problem? Yes, it really is. Whenever we get drilled on, whenever we use our electric toothbrush, which is very good to get rid of the microfilm, we get a bacteria migrating, metastasizing into our blood. This is just true. It is a true thing. But what you want to do when you go to the dentist, I sit there when I get my teeth cleaned and I've got my Notisand drops in my lap, and whenever my hygienist takes a break, or my dentist takes a break if I'm getting a filling or crown, I drop in the Notisand drops. I like them because, well, I'll explain in a minute, but they're good for both acute and chronic illness, in that they don't kill, they just change the environment, they change the milieu, as the Europeans talk about. They increase healthy, beneficial flora, reduce the pathogenic bacteria. But acutely, it's also okay to get ozone, often good to gargle and spit after dental cleaning with ozone, vitamin C, etc. And, you know, I have a lot of patients, including myself. I'm healthy now, but I am sensitive. I'm still sensitive. That doesn't mean I'm not healthy. I'm just healthy and sensitive. I can feel a little low after dental cleaning if I don't handle it. So it's important to remember that you should clean up after any time you get drilled on. Okay, so let's talk about dental focal infections. We already talked about impacted wisdom teeth, which are so common because we just don't have the jawbones of our ancestors anymore because of the toxic foods. Failed root canals, a lot of holistic dentists, biological dentists would say there's no such thing as a healthy root canal. You have to take that one subject at a time, but they always do generate bacteria. It's always a stress. Failed apicoectomies are worse root canals. When a root canal fails, they do an apicoectomy. And they, again, I have to laugh because it's so ludicrous. And they often put a little mercury plug in there, mercury amalgam plug in there. Yeah, insane. So apicoectomies are dangerous. I've never seen one that wasn't outrageous and you had to do surgery. Failed dental implants, less so nowadays. Zirconium is allergenic, according to Dr. Vera Steshkal, again, the late great Vera Steshkal from Sweden, about 2 to 4% of the time. So the zirconium were metallic and a little more reactive. I'm sorry, titanium. I said that wrong. Titanium are allergenic 3 to 4% of the time. But the new zirconium implants are testing really well. They're more a mineral versus a metal, and people seem to be doing all right with them, which is nice because it's hard to deal with missing teeth. Chronically abscessed teeth, and then dental galvanism. And then before we move to dental galvanism, let me just explain. So what a conventional dentist learns in medical school, dental medical school, is that if you have an abscessed tooth, to pull the tooth, and most of them then get out of there, sew you up, and you're finished in what, 20, 30 minutes. And they think they're doing you a favor because you just got, got all done in 30 minutes. But what they're not doing is they're not cleaning out all the periodontal ligament attachments, and they're not literally grinding the necrotic bone, the gangrenous soft bone. Gross, but it's true. It can be such a big infection. Now, a holistic biological dentist will clean it all out and get rid of all that decay, and then sew you up with ozone and Nodosan and homeopathics, and then it's done. Then the focal infection is done, and you won't die someday or get, some horrible disease from those bacteria. So galvanic foci are some of my favorite. So the reason is because you often don't need to pull the tooth. So galvanism, right, a battery. So this is a depiction of a gold crown on top of a mercury filling. And what it's doing is it's creating a battery, right? Gold is positive, mercury is negative. It creates a battery electric effect in the body. Increases the off-gassing of the bacteria and the heavy metals and causes a chronic, for example, right shoulder or right hip problem. And all the Motrin and Aleve and Vioxx, which are black box analgesics nowadays, right? Because they've been found to cause cancer, heart disease, and severe ulcers and stomach perforation over time. So we don't want that, right? So any of y'all with this ipsilateral pain, which I'm going to emphasize, hip, shoulder, foot, knee, whatever, on one side, be suspicious about the related same-sided dental issues. Now, this is what's so great about galvanism. All you do most of the time is just replace the metals. You don't lose the tooth. You just go to a good biological dentist and you get it all cleaned up with ozone and protection and all the good stuff they do to detoxify. So this is obvious. The first one is, mercury. Sometimes the mercury's right under the gold crown. Some conventional dentists, he learned in medical school, or she learned in medical school, that wasn't a problem. They taught that. What they really also learn in dental medical school and dental school is that they're worried about losing the tooth too much, which is not true if you've got good technique. So they tell them not to drill too deep, right, or you could lose the tooth. So a lot of the conventional dentists would just drill some of the old filling out, some of the old mercury, and then put the gold crown on. Again, it's what they learned in school, thinking they're helping you because then they're not disturbing the architecture of the tooth too much. But it's not helping you to have gold and mercury sitting there creating a battery 24/7. Now the other one that's not as well known is porcelain fused to metal, or PFM. How many have these porcelain crowns? Super common. They don't tell you that most of the time underneath the metal sleeve is stainless steel. And what did they put after World War II in stainless steel to make it stronger and more resilient? Nickel. Nickel. Which is not only carcinogenic but allergenic. Now, some of them also have gold underneath them, or palladium, but those can also be problems. So all your porcelain crowns are not just porcelain crowns. Most of the time, unless you've been going to a good dentist, they are metal. So here's Vera Steshkal's information again, a great Swedish researcher. She just died a few years ago. But she took lymphocytes, white blood cells, in the body of all these different patients, 3,162 patients diagnosed with chronic fatigue. And she tested the lymphocytes, the white blood cells, to determine allergenicity. Now this isn't toxicity, because look at old mercury back here, it's 4th or something. So this isn't toxicity. We know mercury is the most toxic non-radioactive metal on the earth, right? So this isn't toxicity, this is allergenicity, like an allergy, how it affects you. Nickel was #1. So not only is nickel a proven carcinogen, but it's also the #1 allergen in these PFM crowns, in these nice looking PFM crowns on the surface but are a problem. But look, palladium was second. Now palladium is in the mixture of gold, and as Leo will tell you, the Europeans and the Germans found that palladium gold crowns were even harder to detoxify from than mercury. So palladium is not just a precious metal that's not a big problem, it's a problem. And gold, the third most allergen. So, you know, all these metals, like gold used to be the standard, the gold standard, right, in the early 1900s and in the middle of 1900s, and still is to a lot of dentists. They think they're doing you a favor, but they're often not. Sadly, see that ELISA test down here? So sadly, this was a very decent test. It was a lymphocyte test designed by Dr. Steshkal, available in the United States, often free if you had insurance. It's moved back to Germany. So you can call them, you can get this ELISA test. Say, for example, you have a titanium implant. You're really trying to make an important decision here. The ELISA test would be a good one to go through. The problem is getting the blood over to Germany in 2 to 3 days, and the expense, it's just become a big pain. And it's sad because heavy metal testing is not easy. The catch-22 is, I used to work with Dietrich Klinghardt, and we used to, we realized that the healthy dentist that would test, who had tons of energy and ran a big practice, had super high levels of mercury through the urine, through a provocation test. But the chronic fatigue patient on the couch all day, it didn't move at all, it looked great. So what I'm saying is that it's really hard, even through urine and fecal tests, to determine the level of heavy metals in your body. Patients always want to know that, and it's hard to determine, and a lot of these tests are not very good at it. Plus, the provocation tests, you have to inject DNPS or take DMSA, and those have their own problems. They deplete minerals, and they're ultimately toxic to the body. So, very sad about the ELISA. Hopefully, it'll come back to the United States.
How did that happen? Who pushed it out of the United States?
I don't know, Leo. I don't know.
Was it that FDA that I heard about?
Might have been. You probably know better than I do. So, anyway, I was so sad because actually I'm not big on tests. I found so many of them faulty. But the ELISA was, I used to say it's about 80% right. It was a damn good test without provocation. Didn't even have to inject.
Yes.
Okay, so again, I just want to emphasize ipsilateral. So important, the same side. This is one of the takeaways from today. If you have if you have chronic hip pain on the right side, think of your right teeth, right-sided teeth. Do you have a root canal? Do you have an embedded wisdom tooth that maybe you don't have room for? Do you have dental galvanism, heavy metals there? Same thing with the left knee, think of the left side, etc. It's not always true. Everything can cause everything in the body, but this is a really nice diagnostic standard. And if you get a serious illness, if you get a serious diagnosis of breast cancer or any other serious issues, it's not the time to be conservative. You really want to go to a good biological dentist and get what we call dental revision, which means you've got to get rid of all the focal infections, all the silent dental foci sitting in there like time bombs that could eventually kill you. I have a good friend who specializes in cancer. She worked with Dr. Kelly Enzymes and cancer for years, Pamela. And Pamela has found in her extensive research that getting rid of the mercury amalgams is not such a good idea to do when you get a diagnosis of cancer, because it can increase the size of the tumor and the toxicity. But you got to take each case as it goes. I just had a patient with prostate cancer. We sent him to Nunnally's office in Marble Falls in Texas. They did the whole dental revision. He had 1 mercury filling, so we got it out. The guy was strong. So it depends, but in general, think about removing the teeth. Don't think about getting rid of your mercury right away. Get the tumors regressed and down before you consider that. So this is my book on cavitation surgery, and you notice this word 5. 5 means the day of and the 4 days after of surgery, you hit fire with fire. And what this means is, like we said before, the biological dentist thoroughly clean out the socket, clean out any of that gangrenous bone, inject ozone, homeopathic remedies. It's a beautiful thing. Really, when it's done well, people feel so well taken care of and so much better. The reason I say 5 days is because of the toxic metals and the surgery. Clinically, I found that to be true, but also in the research they've found that those 5 days are the period of acute healing. And what is acute healing? This is another big takeaway. It drives me crazy with some of my colleagues that treat autoimmune disease or patients who are really ill with 5 to 10 to 15 symptoms with these strong bacterial killing microcidal products. You can't treat things chronically by killing. Are we doing that much better than giving antibiotics? Ozone's making the bacteria smarter. Oregano oil kills everything. These are fantastic tools, but think about them with acute illness. You're coming down with the flu, go crazy. Go take oscillococcinum from the health food store, put some oregano oil or peppermint oil on your throat, gargle with silver solutions, kills everything. Hit fire with fire. It's appropriate. But chronic illness, a chronic dental focal infection, a wisdom tooth sitting back there, a root canal that's been sitting dormant for years, all these things that are chronic and old, we call them a smoldering fire. Don't stir them up. Don't hit the hornet's nest, or don't poke the hornet's nest, right? This is when I love the Notisan drops. I use it like water. Also the aspersen drops, again, because they're one of the few German drops that mitigate the environment but don't kill like an antibiotic. People love them. It's on my protocol, of course. Natural supplements, a clean diet, and of course I specialize in constitutional homeopathy, the new system, the sensation method, and that's really important just to get your body functioning as healthy as it can so it can naturally throw off disease, right? That's the best way to get well, not taking a whole bunch of stuff. Okay, so what about vice versa? What effect do chronically inflamed and degenerated organs have on the teeth? So we know cavities, gum disease, abscessed teeth, etc., all kinds of problems to the teeth are caused by bacteria. Learned that, it dissolves tooth enamel. That's well known. Why does it do that to the teeth so much? Well, for many reasons. The mouth is a major oral microbial environment that can get out of hand. But I like to explain it a lot with this preference pyramid. The body's got to survive. We've got to wake up, eat breakfast, go to work, survive, right? We got to be here. And in order to survive, the body in its wisdom will sacrifice tissues not vital to life. So I adapted this from George Vatulkas, who's a Greek homeopath. So basically, what the body's wisdom does is it says, should I sacrifice the heart or the wisdom teeth? Should I sacrifice my liver or my brain or my skin? So what if I have a skin rash? So is my belief, and a lot of people's belief in holistic medicine, that these bacteria are shunted to less vital tissues in the body. Okay, and it's nice because then it's a signal to you, a symptom, something's going on here. It's not just my mouth. What am I doing wrong? Okay, major causes of dental cavities. We talked about, the toxic diet, food allergies we'll talk about, xerostomia, I'm forgetting that word, the name for dry mouth. Yeah, anyway, that's a real common name. What happens when you don't have enough saliva in the mouth? You get cavities. It's a real problem. So everyone that's on drugs nowadays often has dry mouth, plus the bisphosphonates break down bone and the jawbone, and that's a real problem for dental patients. And then, of course, as we know, conventional dentistry, mercury amalgam sitting next to gold, and all kinds of bad dentistry can cause gum disease, dental disease. Everybody knows about sugar, but Melvin Page, another great biological holistic dentist and of course great nutritionist, discovered that the sugar disrupts the calcium-phosphorus ratio, the mineral ratio, which allows the bacteria to proliferate in the gums and teeth. Specifically affects the teeth. Nancy Appleton, great author, she gave me permission in my book to list her 141 reasons not to eat sugar. So I have that listed in my book that cause everything besides gum disease and dental disease and cavities, etc. And again, it's not easy. I mean, psychologically, it's not easy just to give up all these sugars, especially when all these other people are out there. You know, we're in this crazy world right now, so I really feel like you just have to keep putting 2 feet in front of you and really be convinced to the core of your being that sugar is a problem. And use your organic maple syrup and use your organic honey, you know, and substitutes when needed. So of course, children are warned all the time, sugar will rot your teeth. Specific relationship with the pancreas and the molars. But adults are not counseled so much by their biological dentist. So again, we've got horrible sugars nowadays. Refined sugar, high fructose, corn syrup, aspartame causes brain cancer, gallbladder disease. High fructose corn syrup can only be broken down by the liver and it's quite toxic. Refined grains, and we have degeneration of the pancreas with all these toxic diets. Here's another picture close up. Again, here you see, here's the, when I need my, oh there it is, okay. See the heart and the duodenum, the small intestine, heart and the ileum, the small intestine. So the wisdom teeth specifically relate to the heart and the small intestine. The molars specifically relate to the pancreas and stomach. And what teeth do you mainly get filling cavities in? It's always the molars. It's not the front teeth, not the canines. It's almost always the molars first. So again, when you have a cavity in your first molar, consider the fact that not only is it sugar systemically, but it's also the direct relationship through these organs. And toxic fats. How many are Weston A. Price Foundation members? Yay. Okay, so we should all join. I'm not a Democrat or Republican or independent anymore. I'm an IABDM member, and I'm a Weston A. Price Foundation member, because no politician has the nerve to talk about vaccines, right? Or holistic medicine. None of them do. So far, I'm waiting on somebody. I'll give them anything I can, but nobody's running. So support your organizations. Anyway, toxic fats. This is what the Weston A. Price Foundation talks about. Our grandmothers and great-grandmothers were correct. They cooked with lard. They cooked with beef tallow. They cooked with coconut oil or red palm oil, some olive oil, cod liver oil they took every day. So the fact is that when you cook, which we learned in the 1950s and the mid-1900s, you know, that was so popular, to cook and eat safflower oil and sunflower oil and canola oil. When you cook with those, I don't care what that stupid burning point is, what's it?
Yeah.
The heat point.
Yeah.
Smoke point? Smoke point?
Smoke point, thank you, sir, yeah. The smoke point will drive you crazy because you see all these vegetable oils up there. I don't care about that. The amount of toxic aldehydes and free radicals that are carcinogenic that these vegetable oils create when we think we're doing the right thing and cook with them is outrageous. Outrageous. So it was a mistake. And how did Nathan Pritikin die? Everybody remember Nathan Pritikin?
Yes.
He was a vegan, not just a vegetarian. Was he vegetarian or vegan? Anyway, just one of those. And remember, that was the low-fat fad in the 1950s, 60s.
Yeah.
He committed suicide because at the end he had cancer so bad he couldn't face the fact that his life was a lie, that it was wrong. So the low fat is not a good idea. Eat good fat from saturated fat from animals like our ancestors did, and to lose fat, right? I lost weight on the Weston A. Price diet. Okay, food allergies, another huge problem nowadays. Where did it start? The vaccines, the heavy metals, the chemicals that were injected in us, the antibiotics, the toxic foods. Nevertheless, take food allergies seriously. I'm so sorry to say that even in my practice, when I feel like I've gotten a patient really healthy up to a certain level, we still have to watch it for quite a period of time. Because those T cells and those B cells have mast cells. They have an incredible memory. That dairy or that wheat is like a pathogenic bacteria attacking your thymus gland, etc. 24/7. How many times do we eat? 3 times a day? 4 times a day? Snacks? So primary chronic food allergies, I find dairy a real problem. Wheats, a lot of people that were saying, you know, everybody's avoiding gluten, right? It's the thing. A lot of people are going back to gluten because they're using good sources. They're cooking the bread correctly, you know, with sourdough, which is so much better than yeast. And a lot of people can do gluten. Einkorn, who's heard of einkorn?
I have.
Einkorn grain. You sell it?
No,
You use
I
it?
bought a bunch of it.
It's fabulous. So einkorn means one grain. It doesn't mean corn. E-I-N-K-R-O-N. It's from Mesopotamia. It's from ancient civilizations. It hasn't been hybridized. Now, much at all. Hybridization is not a genetic modified. It's not that bad. But it's still, when they take vegetables or fruit and they hybridize them over and over again, it increases the amount of chromosomes, and it makes them more indigestible and more complex. Einkorn has like 2 to 4 chromosomes. It's a very simple grain, loaded with gluten, high gluten amounts, and yet patients even diagnosed with celiac can eat einkorn bread. It's amazing. So anyway, that's been overblown. Eggs are more of a kind of a childhood allergy we go through, and when I have patients and we're going through the healing process, the eggs often come up as we're retracing and opening those old doors and detoxing. But you know, a lot of times you can do variety and rotation with those. You can have duck eggs on Monday and chicken eggs on Friday for a while, but don't do things every day because we're too injured. So like we said, it's like being attacked daily, but it's also often silent. You have a grilled cheese for lunch and at 3 o'clock you're tired, you know, or the next day you're achy. What's that got to do with the grilled cheese the day before? These are slow mediated reactions. Not IgE like peanuts or strawberries. IgM, IgG, slow immune system reactions that can occur a day or 2 later. So again, it's a tricky one. So here's my new website, and here's my new blog. I have a blog now. I'm trying to catch up to the 90s. Can't catch up to the 21st century yet. Anyway, this is the classic allergy elimination challenge test. The gold standard diagnosing hidden food allergies. So instead of a $400 blood test, and there's so many faulty ones out there, you avoid your particular chosen food for 2 weeks. You see if you do better, and then you eat it again, and then you see how you do. And it's fantastic for determining which of the food allergies you have. And there's also corn and, you know, other food allergens, but the big 3 I found are dairy, gluten, and eggs, with dairy being the worst. So V&R, variety and rotation. Now, Sally Fallon Burrell, the head of the Weston A. Price Foundation, likes to talk about apples in the late 1800s, early 1900s. You would go to the market, you had like 100 varieties of apples around the country. There were just so many varieties of apples. Again, they've been hybridized for sweetness and enjoyability. You go to the store now, what, you get 4 to 6. So because we don't have little farms like we used to, and because we're getting the same wheat over and over again, the same type of fruit or vegetable over and over again, that causes this allergy tendency because it's stimulating the body too much. So, for example, if you have a dairy allergy, Mount Capra in Washington State has this ghee, and they have laboratory tested it, and they've found no casein, and no lactose, of course, and no casein. That's very unusual. I'm sure there's a trace there, but it's very low. So this is a godsend for those of us that want good fat in our diet but have to watch the dairy. Often we'll do variety and rotation with grass-fed butter, the ghee, the butter, but just not eating the same thing. Even though butter's the least allergenic, it's still a problem if you have a dairy allergy. So practice B&R. It's hard when you're single or just 2 people at home though, right? Again, going back to the earlier times when there were bigger families or communities and you'd have different foods on Monday or Tuesday or Wednesday. Today I'll go to Whole Foods and buy organic cottage cheese on Monday. Well, I'm single, I'll eat it Monday, Tuesday, Wednesday, right? Finish it off, and then by Wednesday or Thursday, might be tired because that's too much dairy and the same allergen over and over. So vegetarian diets, the great late Hal Huggins, the father of holistic dentistry in America, I like to call him, he would not operate, he would not do cavitation surgery on vegetarians because they didn't have enough good fat or protein to repair and regenerate after surgery. I've never worked on a healthy vegetarian or vegan. I've never found one with my testing, my energetic testing. I've just never found one. And the biggest problem with a vegetarian is what 2 foods are they going to often eat a lot of? Dairy and eggs, right? Not a vegan. Vegan wouldn't eat any of that, but a vegetarian often they overdo the dairy and eggs because they don't have much protein to choose from that's bioavailable. They don't have the vitamin A and the D and the B12 that they need. The Wise Traditions diet, the Weston A. Price. Everybody know the story of Dr. Weston A. Price. Okay, well, here we are at the Biological Dental Seminar. So Dr. Price was a holistic dentist in the 1930s. He and his wife went around the world every summer to try to prove that vegetarian diets were good. That was his premise. So he went to the Alaskan Eskimos, the New Zealand Maoris, the South Sea Islanders, the Peruvian Indians, and he completely failed. Not one of those healthy 14 cultures were vegetarian. They all ate meat or seafood and all of the animal and all of the fat and utilized all of that. They often had all 32 teeth, wide development of their cranium and their facial muscles and bones, and a lot of the cultures didn't have words in their language for anxiety or depression. Didn't even have it, because you see the pictures and they're just happy, they're smiling, So anyway, that was born, the Wise Traditions diet from the Weston A. Price research. Very important. You can't digest your protein without good fat. Take that boneless, skinless chicken sitting in your salad and throw it out. Throw it away. None of those traditional peoples would eat boneless, skinless chicken. You can't digest it. It's dry, and the fat-soluble vitamins aren't there. The A, the D, the E, the K2, they aren't there for you to allow assimilation of the protein and the fats.
Let me comment.
Yeah.
You go to Whole Foods now and you buy their yogurt or their kefir and low fat, no fat. I would never buy low fat, no fat dairy.
Absolutely.
I mean, that's exactly an application of what you just said, and I think it's very important what you're saying.
Yes, and it came from that 1950s BS. We were fed about fat's a problem, right?
Yeah.
Where in the early 1900s, our grandmothers, they were cooking with lard. Lard is excellent. It doesn't break down, and it's so good for you. So, yeah, it all came from the incorrect dietary information that was fed to us by the government and the FDA, and nobody's coming around except these individual organizations and trying to teach the truth. The government certainly isn't. Okay, so you might want to take a picture of this slide, westonprice.org. They've got a great vegetarian flyer. Talks about a lot of the research showing vegetarianism is not a good path. Sugar information, and then the last one, industrial fats and oils. Real problem. So those are brochures that are worth reading. Okay, so if you have intermittent tooth pain or just a little ache here and there, or every few months a little irritation, or you have pockets, what are the dental hygienists, 4, 5, 6 pockets, those are real problems. The best preventive medicine is to clean up your diet and see if the dental symptoms clear. The question is, what do we do? Do we spend our time and money on the teeth, or is it the gut? I have a personal story about that. I had cavitation surgery twice on number 32 on my last wisdom tooth socket. Twice, and the second time I had it, that was after the conventional dentist pulled it, so I guess 3 times. But I had correct cavitational surgery on number 32, and the last holistic dentist that worked on it said there really wasn't much problem with it. He said maybe the architecture was a little uneven, so I just filed it down. Maybe that was the problem. But what was happening? It was my gut still. It was still inflaming that right side because I was still doing dairy and not eating as well as I could years ago. So once I changed the diet, that little inflammation that I thought was the focus went away. Here is the famous Martin Fisher. I have him in here just to remember this stuff isn't new. In the 1800s, it was a beautiful time. In the early 1900s, at the turn of the century, focal infections, that was the heyday of research. Dr. Rose now, Dr. Fisher, Dr. Price, they were all pulling teeth properly, doing cavitation surgery back then, and curing arthritis and heart disease and paralysis and all these kinds of illness. Now what Dr. Fisher says that tonsillitis when you were young, those of us that had tonsillitis a lot, and antibiotics, and now we're okay, we don't get tonsillitis. Well, a lot of these early diseases are the diseases of childhood grown old. Those, I haven't talked about the tonsil focus, but it's a hard one. It really relates to dairy allergies, toxic antibiotics, need for Notisand drops, and the need for the constitutional homeopathic remedy. Because you've got to change your constitutional. In Europe, they actually call chronic tonsillitis an angina miasm. Why do they call it that? Because these chronic tonsils that as an adult maybe don't bother you as much, but are swollen from time to time or inflamed a lot, where does the bacteria go? Straight to the heart valve, just like the teeth. So again, this is old medicine, but it's not taught nowadays because everything's drugs and surgery. There's the 5 dental detox days I was talking about. Again, 5 days, the day of dental drilling and 4 days after, very important time to hit fire with fire. You increase your algae 3 or 4 times. You take arnica 3 times a day the first 5 days. You take hypericum to make sure the nerve's not injured 3 times a day. Take the Notisand drops and the ABSCESSED drops. You hit it hard, and then afterwards on the 6th or 7th day, often you're really doing very well because you hit that acute trauma of dental drilling fast. And again, the magic number 5 also works for cavitation surgery. Hal Huggins, when I was at a seminar, I got to lecture with him many years ago, he said something that I just loved. He said, watch the vibration after surgery. And it was so true. Patients, when I used to live in Seattle, and patients would fly in and then fly out, that often have problems. After dental surgery, you want to lay flat, you want to relax, you don't want to talk too much, you want that socket to heal. You don't want to reinfect it, because it's a real problem. So do it right the first time. Clean up your teeth, get all the toxic teeth out, get all the toxic metals out. Clean up your diet, and watch the food allergies. They're a real problem. Watch the dairy, wheat, and eggs until you're at a healthier level that you can eat them more. And then you can get to health. Again, another old paradigm, functional illness versus degenerative illness. So this psoric person is somebody that gets a rash once in a while, or gets the flu, and 2 days later, he or she is fine, okay? That's the psoric at that first level. The tuberculinic gets the flu and is on the couch 3 weeks later, see? And has achy joints, not just intermittent joint pain in this middle category, psychotic SY, but racking aching joints. And then we get to the luetic, which is just chaotic emotion. Insomnia, anxiety, all kinds, more of the autoimmune diseases and cancer here. So a lot of us are here, but we do have a foot or two in these more degenerative conditions. So this is our good roadmap. We're trying to move us from here all the way over to here to health. Where, a year later you say, what anxiety? I don't feel that anymore. I don't have that.
If you're, like you have a particular myism or something, and you're a person that maybe, I guess, is a slow detoxifier, can that be affected by something that's inherited, like?
Yes, if you're a slow detoxifier, it's hard to get well. A lot of times that means you've got a foot or two over here in this degenerative condition. So then you have to be very careful, like I've been saying. Don't go out and kill with herbs and silver and oregano. Get on your constitutional remedy. The constitutional remedy, according to the new sensation method from India, is the most important way to get your feet on the ground and to start really healing. Because what it does, it's a plant, animal, or mineral remedy that slowly dissolves your particular tendency, wherever you are here.
So that could change the fact that you're a slow detoxifier, probably, maybe?
Sadly, yes,
Or
because
is it possible?
oh, it's absolutely possible. Sadly, I don't see patients who grew up in America. Europeans not as much, but patients who grew up in America that had the antibiotics, the toxic foods, the vaccines. I don't see them getting well without the constitutional remedy. It's really essential. So, let me know.
Do you do a form of muscle testing or
I do. In fact, I may do
that.
Yeah, I may do that in a minute just to show you all back to the dental. But anyway, this is a great roadmap. And again, this is a homeopathic history. And the nice thing is that homeopaths understand getting well and getting ill. In other words, say for example, I have a patient and they come in with anxiety, okay? I get them on their constitutional remedy. They call me 2 weeks later and they say, I've got a major rash all over my stomach. And I say, how's your anxiety? And you go, it's a lot better. It's about 50% better. Am I happy or sad? I'm happy.
You're happy.
Because we moved from less anxiety the last 20 years, for God's sakes, over here to the more psoriatic, the toxins coming out to the superficial skin. We're going to die from skin rash? No. It's a good thing. Okay? But the opposite thing would be somebody coming in with, intermittent joint pain. I put them on a remedy, and 3 weeks later they say, I've got insomnia. Am I happy or sad? Very sad. Very sad, because their more superficial joint pain has moved over to insomnia. So then I have, we redo the interview. The interview is very important to determine which remedy is exactly right. And there are thousands of remedies now. That's the ball game. That's the hard thing.
So when you get that skin rash after a remedy,
Yeah.
that's like a discharge.
Yes,
So it's moving from a deeper place of the body out to the surface, and that's
Absolutely.
the healing path.
absolutely. Classic homeopathic understanding of how the body heals. It's
Yeah.
not a bad thing. And the other thing is when you're on the correct remedy, often that rash and discharge will heal faster. Say I come in with psoriasis and I get a little more psoriasis after the remedy, it'll calm down, and again, 2-3 days to a week, not, it won't last and last and last. Healing becomes more, see this sort of good energy, you recover more quickly.
Can I ask you a quick question? I understand the whole thing, it's sort of rash. The rash is, pops around the body.
Yeah.
Acne's on this side.
Yes, severe acne, cystic acne.
Gotcha. So if it was minor acne, is that kind of like the rash? Is that coming out?
Yes, yeah. Well, acne is teenagers is usually toxic diet, right? But I know, it's a good point. This is not so easy to understand. This is years of homeopathic history about miasm. So some of the things that, I have a little insomnia, it's not a problem. Actually, that is pointing to something that is a problem. So, but yeah, like rosacea, a reddish complexion to the skin, that's often more a leuetic miasm, but it doesn't mean that you're 100% in this category. See, we all have pieces of this. But again, as we get well, we go from, again, a year or two later, what insomnia, I sleep like a baby. On the remedy, the best thing you want to hear on a homeopathic remedy is when you're asking the patient, well, what about that depression that you had? And they go, what depression? I don't remember any depression. Like they literally don't remember. I don't have depression. Sometimes they say, like, okay, happy to hear it.
So the depression is a deeper problem, and if it moves out and the symptoms change,
Yeah.
you're dealing with it.
Yes, severe depression, that's over here, suicidal, milder depression. I go to work Monday through Friday, but on the weekend I'm on the couch all weekend because I'm so tired and slightly depressed. See, and then hardly any depression, and then here, what depression? I'm sad when somebody dies or something, but I don't feel that black cloud hanging down, coming down on me anymore.
And when they get you into the hospital and give you antibiotics for 2 weeks, they're driving the problems deeper in and making it harder for your body to discharge
To
them.
expel,
So it's kind of like
absolutely.
the opposite of homeopathy.
Yeah, allopathic medicine is just completely the opposite of homeopathic medicine. Homeopathic is just little small microdoses to stimulate the immune system gently, very gently, to remind the body what it should be doing. Allopathic medicine, big old heavy doses to suppress the symptoms. Complete opposite. And why we're number one in, Ty was just saying how we have horrible statistics, even though we have the best healthcare in this country regarding health.
Most healthcare.
Yeah, we have the most healthcare. Okay, this is my new website. I'm very proud of. My designer and I have been working all year on it. It took a year, and it just launched 2 weeks ago. So I just wanted to say, please come by. There's a blog. I have my blog, and then the shopping part. All the products I have been energetically tested with muscle testing, with my type of testing. So, how much time do we have?
11:35?
And we finish it now.
Oh,
Okay. So, did we want to test? Yeah. So, did you?
I haven't eaten meat in 5 years, Sister.
You have what?
I haven't eaten a single piece of meat in 5 years.
Oh, vegetarian. Okay. Well, that's a little harder to test. Do you drink dairy and eggs?
I don't do dairy or eggs.
Oh, you're
or
vegan.
gluten.
You're a vegan. Okay. Okay.
we're like keto alkaline vegans. I know.
Gonna be harder because you probably are disturbed from the beginning, in my experience. So I need somebody that's Yeah, let's test her. Let me, because I just want to show a dental focus while we're on the subject. So, let's see. Let's do this. Okay, so have a seat right here. Yeah. All right, so no cell phone, no hotel key.
No, just this little thing.
Yeah. Okay, good.
And I've got earrings in, is that?
Usually okay. All right. So you can do muscle testing. You can do what I do this arm length matrix reflex testing. Do you have a tooth you're worried about?
Well, it's funny because you worked with me over the phone. So I had a root canal done on my upper lip. My name was Julie, right? But they left a file in my root canal, perforated into my sinuses.
Yes.
And that's been it started in 2005, and it was 2015 before totally, I went to lots of biological dentists and had cavitation surgery. I still have all this going on.
Okay, so you did go to biological dentist.
Well, about 4 of them.
Okay.
And
they got the file out.
yeah, they got the file out the first time and did surgery, a cavitation, and then found out that you're the one that suggested on the phone that I have an x-ray or a CT scan.
Yeah.
And I did that, and they found out there was dental material in my sinuses.
Really?
Because it had perforated.
Perforated up.
And so that was a process.
And they got rid of that.
Well, yeah, finally, but
Okay.
I went to several biological dentists.
Yeah.
One of them said he was going to remove it, but all he did was cavitation surgery.
I want to introduce you to Leo over
And
here.
I know him. It's been a while since I've
Leo
talked
goes
to him.
to every dental seminar. So if you want to know in your area the best cavitation man, the best or woman, the best detox mercury amalgam remover, call Leo. And then please give a donation to his nonprofit organization, DAMS, Dental Amalgam Mercury Syndrome, because I know he gets sick of my patients calling him, but I refer to Leo all the time because Leo keeps up on who's really doing the work. Who's doing a
I
good
do
job.
my best. I tell
It's
people,
been a long
I'm not
time, so I used to
God.
call him.
God doesn't work here, but I do the best I can.
Well, I tell everybody, call Leo, please give to Dental Amalgam Mercury Syndrome, because he doesn't get paid for all these phone calls where he's talking to you and letting you know who's good in Pennsylvania, California, and Arizona. Okay, so we have, is it number,
It was number 15,
okay,
but I don't really know what's going on.
because 16's gone, the wisdom
Yeah.
tooth. Okay, so it's the very back
But it was
molar in her upper left, because she had all 4 wisdom teeth removed
Yeah.
ages ago.
But I've had cavitation surgery.
She's had a ton of work, so what a good example.
Yeah.
Okay, dear, so number 15 goes to where? Pancreas and stomach. All right, so this is the reflex arm length test. So dead weight, super dead weight, very good. And kind of hold the hands up, not stiffly, but just so the audience can see you. Thank you. Okay, so then what we do, usually on a table, but this is better to show on a chair, is the patient completely relaxes, and I pull, women are limber, until I can't go any further, and that means the connective tissue, the fascia, has reached a stopping point. And then I put the hands together, open the fingers up a little bit more. See those thumbs? They're even. Then we recheck again. So limp elbows, we reset the computer, we recheck again. Dead weight, it's hard to do it on a dead.
Keep your fingers straight.
Yeah, keep the fingers a little straight, but relax. It's easier on a table supine, okay? I can't go any further. This is what we call a rubbery fascial stopping point. And she's even, okay? So, according to Leonardo da Vinci, that came into proportion in 1400s. It's a good thing, right? We're supposed to be even, strong muscles, right? Now this is number 15, so let's also do a muscle test. Hold this hand into your side, and I'm going to pull out. You hold it into your side.
Hard to hold it.
Yeah, you try to hold it into your side. I'm going to pull out. and she can't. That's the latissimus dorsi muscle, relates to the pancreas, relates to number 15, right? Hold this right side in and hold, and she can hold that. Okay, again, what did we say? Ipsilateral relationship. So poor Julie has had all these surgeries, done everything she can, so she's a great example.
And frustrated.
And frustrated. Anybody a dental hygienist, or yeah, can you come up? So if you stand over here and put on your right hand, put on a glove, Lisa. Okay, stand over here, and would you therapy localize her number 15? And I just grab the tube and the gum.
You want me in her mouth? Okay.
Gently, just therapy localized. It's just, hold number 15. Okay, so she's, oh, 15? Oh, because it was pulled, right? So
14.
no, the socket. So hold the socket, 15. Yeah, sorry. Okay, limp elbows. Are you okay? Okay, yeah. Or you can even take just one finger and hold it. That's all right. Yeah.
Are you okay?
Yeah.
I'm not like I can hear anything.
Okay, so she's therapy localizing. What are we asking the body? Is there a problem? Right? Limp elbows, same thing. Here we go again, hands up. Hands up, very good. Dead weight, again, easier on the table. Dead weight. Okay, this is this fascial pull. I can't go any further without cheating. I put her hands together. What is she now? Right short, isn't she? Do it again, reset the computer. She could be doing something called oscillating, which means she's right even, or she just could be right short. Dead weight. Even. Do it again. Put her together, right short. Do it again. Notice a pattern. Even. So this is oscillation level 2, indicating that the body's in a little chaos. It's disturbed. There's 7 levels, so it's not all the way down to the haywire, crazy 7 level, but the body's at level 2, oscillating, trying to find balance, trying to find healing. It's a normal problem. Okay, so now with your other hand, and I'll keep that, with your other hand, let's have you therapy localize the pancreas with a knife edge like that. Okay, so kind of push in a little. Very good. So again, in the clear, she's even. Dead weight. Dead weight. Very good. Hands up a little bit. So, she should be even, right? In the clear, she's even. Can't go any further. Thumbs. Not even. Left short. Do it again. Dead weight. This builds my traps. That's why I didn't ask you to come up first. Men's arms are a lot harder. Even. Again, keep testing. Left short. It appears she's oscillating on with the pancreas therapy localization too. Even. So oscillation level 2 to the right with number 15 socket. Oscillation level 2 to the left with the pancreas. So perfect example. Is it the pancreas or is it the tooth? Julie's been through all this work, but still it's not fixed yet. So then what we do is we mitigate the 2 areas. We percuss them. We percuss them because in a way that's a treatment to the nervous system. It's a way of communicating to the body. It's bringing it up. And the area that's not the biggest problem will go away. Okay? So dear, would you gently tap number 15 socket, and I'm going to at the same time tap the pancreas reflex. Now, of course, this is just a skin reflex. The pancreas is very retrosternal, but it's in this particular place. So we tap. Very good. Now we start over. So, here we go. So now we relax. Very good. Okay, remember she's been even in the clear the whole time. She's done enough work on herself that systemically in the clear, she's even. She's better. Okay, she's even. Okay, let's therapy localize number 15 socket. So, okay, so we can go back to that. Is that mitigated? You know, is that reduced? Is that the big problem or not? Okay, so you're holding. Oh, no, sweet, no, just hold it.
Oh, just hold
Yeah.
it back.
Yeah, you've already treated it. Now you just hold it and you're saying, is this a problem?
Okay.
So just therapy localize it, neutrally.
I'm not, okay.
I'm just gonna hold my finger, not move it, just hold it.
Yeah, not move it, yeah. Okay, you can relax, yeah. Just a gentle, you're just gently holding that socket and saying, is this a problem? Okay. Very good. We are even. Reset the computer, check again. Relax, good. Hard to do this in a chair. We're even. And percussion is an old chiropractic technique. Again, in the 1800s, early 1900s, we used to percuss back when I was living in the 1800s. You know, I talk about that time, but to me that was a really important, amazing time that's been so suppressed by conventional modern medicine. But anyways, percussion was a good treatment, you know, for all kinds of things. So her number 15 socket is saying, I'm not that bad anymore. A little percussion helped, okay? Now, knife edge, therapy localization, push in medium hard on that pancreas reflex. Is the pancreas a problem? Bring her together, hands up. Right sharp, right? Do it again. Bring her together. Even. Do it again. This oscillation, it has a certain pattern to it. Right short. So the pancreas is not satisfied. This percussion is not good enough. So we learned a little bit that even though this is a problem, you have trouble with sugar handling on the left side of your pancreas. So we'd want to question you about your
I
diet.
eat really healthy.
Eat really clean. Do you do dairy, wheat, or eggs?
No.
No. So she eats really.
I eat ghee. I use ghee for all my cooking.
Yeah.
But that's really not,
Yeah.
it seems to be the only thing that I can cook in.
Hmm.
I mean, I'm really, my diet, I have to be fussy with it.
Yeah.
because I don't.
You don't
It's
feel
even
good.
worse, yeah, than things are right now.
Yeah. Well, I would guess it would be, you're the perfect candidate. You've done your due diligence with your diet. You've done your due diligence with your teeth. You'd probably need your constitutional remedy.
I think that.
That's the thing that's left. So hold on a minute.
Because I grew up with a lot of antibiotics, so
Yeah.
either I had tonsillitis.
Me
or-
too.
Or I had a bladder, a urinary tract
Yeah.
infection.
I had so many antibiotics as a child. It was crazy. So we got damaged. And then they injected us with mercury and aluminum on top of that from the vaccines, right? Now, you know, I'm a baby boomer. I only got 7 vaccines. Now children are getting 70 vaccines. But that DPT had aluminum in it, and you know what they're discovering about aluminum as an adjuvant now? It doesn't go away. It stays in the tissues forever. Here's the Notisan. I'm just going to treat her. And you can have the Notisan as a good patient. I don't want to pay Lisa.
Can I ask a question? Appreciate that, Doctor.
So dear, what you can do, this is the Notisan drops. They're amazing. they're isopathic, they're not homeopathic. So what's so nice is that they won't disturb your homeopathic remedy. You can take them at the same time. So we can treat that pancreas right over there, or we could even drop it in her elbow crease. And as the Germans say, einreiben, rub it in vigorously. And that is just systemically helping her body, because homeopathics are energy medicine. Now, would you hold her pancreas again? That's not the whole treatment, that's part, but I'd probably send you home with either putting it here or on the pancreas, because that reduces inflammation in the body. So holding the pancreas, we check again with that treatment that wasn't even right on her pancreas. She's even. So that notosan, yeah, you can almost feel it. That notosan mitigates all the damn antibiotics we have as children. So much. Even. And nice and even. Okay? And now let's check her latissimus dorsi on the left side that relates to the pancreas. Hold that in, hold it tight. Much better. Much better. Okay, so, yeah, very good. You guys, here's your free bottle. I always carry these little Uline baggies. Uline, this is a big old industrial company. So they have these Faraday cage baggies. And that's when you're fine, you keep your homeopathics in. It's made of aluminum and a plastic shield. Thank you. In the city, when you're going on toll roads. Anyway, you call Uline and you order those baggies. And I even keep my vitamins in there, my herbs in there.
I want to ask a question. What are your thoughts on eating fish as far as the heavy metals and everything?
Yeah, watch the ones that are the big ones. Does she eat a lot of fish?
Big fish eater.
Big fish eater, maybe.
Well, no, I didn't used to be, but I have been.
Yeah. Yeah, I would watch the bigger fish because of that mercury
I eat
accumulation.
sockeye salmon. When I eat fish, I eat sockeye salmon.
From Alaska,
Yes.
not farm raised.
No.
Twice a week?
Maybe, but you just seem to eat it lately.
Because every time we go on a trip,
Because,
she's eating
well,
fish.
I
won't
try
touch
to eat
the
clean
stuff.
meat,
Yeah.
so I don't have the choice of getting
Right.
grass-fed chicken, or I will raise.
I tried to order that duck fat last night and it's off the menu. They had a duck fat bangers and I'm like, I'll take that. It wasn't on the
But
menu.
so when I travel, I do eat fish because that's the only thing I feel like.
Yeah, but you got to watch it because it's so farm raised. Very rarely
Yeah,
is it from Alaska.
and you're
But
right.
no, I think, Derry, you're like me. You got damaged with those antibiotics and those vaccines, and our gut dysbiosis is considerable. Gut dysbiosis, bad bugs in the gut, really not easy to heal.
Well,
It
I
takes
feel
years.
different. Whatever you did, I feel different.
Notosan's amazing.
And I would like to find out what my consultation was.
Yeah. Well, let's do it. Call me again. Good to see you.
Well, I'm excited because you were one of the speakers I definitely wanted to see.
Oh, well, thank you.
Yeah, we drove up here, man. because she wanted to
Thank you,
see
sweetie. Well, y'all have been a wonderful audience. Thanks so much for coming, and we'll see you at the seminar.
So can you schedule appointments with you, telephone?
Yeah, just email me. Yeah.